Hello viewers, I'm Khalil Ahmed. Today we are going to talk about Lrbt, and for that I am joined by Dr Malik Ahmed Saeed. Welcome to the show.
Thank you very much. Thanks for having me here.
You're most welcome. Colonel Sahib, let's get started with the introduction of Lrbt. In which cities is it offering its services, and how many patients are being treated every year?
Firstly, I want to clarify that I'm ex-army, but I'm a doctor.
I understand.
Basically, I'm a doctor. So whatever I'm going to tell you will be more technical, for the technical side. I'll try to be a little bit more simplified, but
Right.
still it will be technical.
It's okay.
Before we start about Lrbt, I would like to tell you about what is happening in our country. Because we need to have a background that why do we need an eye care and so much, such a big setup like Lrbt, and we need many such setups here. Pakistan is having almost 25 million people, 26 million people are suffering from eye disease. This is as per statistics from the government.
My goodness.
26 million. Now you can understand, population of 250 million or 220 million, we have got almost 10% people who are having eye disease in one form or another.
In the entire country?
In the entire country. Now, regarding the children, almost 9 million children are suffering from that. So we have to understand that the problem is for the children also. And the treatment for the children is very specialized. It is not available everywhere. So anyway, the bottom line was Lrbt with a vision was established by Graham Layton Trust, Graham Layton Saab and Rahmatullah Saab, who these two friends thought that we should have eye hospitals where in the underprivileged areas, mostly where there is no other facility there. So they started from Tobago. And
the first hospital was established
in Tobago in 1985. So it was in 1985 that we established the hospital.
It's a city near Hyderabad.
It is a city near Hyderabad. So that was the first thing. Then the second one was in Karachi, and then they kept on growing and trying to find. Now there are 20 hospitals, of which 3 are tertiary care, and there are 17 other hospitals which are secondary hospitals, and 54 clinics, PECs. This is the first line, are scattered all over Pakistan. Their aim is that within 2 to 3 hours, all the patients should be able to reach nearest place eye hospital of Lrbt. You can understand, if I give you a figure, the figure sounds a big figure. It is, we have treated up to almost 56 million patients up till now.
Marvelous.
56 million is, if you say this,
it's a monumental number.
This is more than 5 crores.
So how do you finance all this?
Yes.
Since the medical treatment is free of cost for everyone in every city.
Yes.
My goodness.
So the thing is, because it's a very uphill task. Lrbt, everybody is trying to, people, the advantage of this country is that almost 60% of the people, for Lrbt I can say this thing, 60% of the contributions are coming from the people inside this country. So Pakistan is one of those countries where people are very generous. They want to donate. They
Tremendous.
don't think in those lines. They just need to find the right place to donate. Because the problem is, there's a, trust is the main thing. So unless people have got the trust in us, they will not be donating. Whether it is in the form of donation or zakat, it's the same thing. Because it is for the benefit of the patients. The second thing is, we try to encourage people who are affording to at least donate, if not donate, at least donate for their own treatment. Because that way we will be able to reach out to more people. We do not refuse any people. For example, in my hospital, in Korangi hospital, we are open till 2:30.
And how many patients visit on daily basis on average?
Approximately 1,600.
Every day,
Every day.
on average.
I can just give you a figure. For example, last fiscal year, it was 460,244 patients. 4,60,244, which comes down to, if you work out the working days, it comes to 1,600 per day.
I understand. I understand.
And
these patients who come...
and operations, the load of operation, we operated more than 34,516 patients last year in one hospital. So if we multiply it by 20, okay, the average every day Lrbt all over Pakistan is seeing at least 10,000 patients per day
I understand.
and operating almost 1,100 patients per day in all over Pakistan.
And
in
all
one day.
this is being done for free.
It is being done for free for the people who can not afford it.
I understand.
The people who can, so this is what I was saying, that it is for free. We do not charge anything from anybody. But the people who can afford, at least they should pay for, not for the treatment, only they should pay for the operation.
But those who can't afford are not charged anything. at all.
Anything.
And generally the patients who come, they are from big cities, like large cities like Karachi, or they are from the villages, and what other cities?
Like when your question was, where are we scattered? So you can understand, if we are in Mansehra, or if we are in Tando Adam, or if we are in Tando Bago, in Gambad, they are they are not big cities. So they are very small cities. We are scattered like that. Arifwala, Lad Multan, not Multan, away from Multan. Rahim Yar Khan, the latest one was Rahim Yar Khan. So they are those places where the services were not there. They are not big cities. They are very small cities.
So there's no need to come to large cities like Karachi
Yes,
or other places.
yes, this is
Since
what-
they have the facilities at their doorstep.
Yes, and Karachi was, there are two hospitals in Lahore, two in Karachi. It was basically in the suburb, in Korangi area. But fortunately or unfortunately, now it has become a city. Otherwise, it was supposed to be where the patients were coming from underprivileged backgrounds. So it is now our services have become so acknowledged that people, the people who can afford it, are coming from other hospitals. I don't want to name the hospitals, big hospitals. Everybody knows in Karachi which is the biggest hospital.
And they pay, and this is the amount which is being used.
And they go there first. Then as a rebound, they come to us. And they think that we are providing their services which they were supposed to be getting there at a very subsidized cost.
I understand. So what are the future plans now, since you guys are offering these services in small cities as well, so people do have access. Now, what are the future plans?
The future plans are, we have just, as my chairman would say, we are just digesting the 20th hospital, which is in Rahim Yar Khan. So let's digest it first.
It is to spread all across the country.
It is spread all. So the vision is, presently we are in 20 places, and because the patients are increasing, one hospital is at its limit. So maybe they need to be expanded, and they keep on expanding. Like in Korangi Hospital, we had subspecialties, 8 subspecialties. Now the subspecialties are expanding, so the departments have to increase. For example, glaucoma. So we have got 3 clinics per week. So we need to have it 6 days a
And
week.
the equipment which is used, like do you guys import all these things from foreign countries?
Yes. We believe in state-of-art things, because we can't compromise on eye or on the health of the patients. Excuse me. So what we do is, our consultants, senior people, they are visiting abroad also for their presentations. So they see what is happening in the world. So they have got access to the latest equipments, because after every 5 years almost, with the kind of advancement, the old things become obsolete. So we need to update it. So in our hospital, we have got nothing other than we have got American things, Americans, Japanese or Heidelberg, the Germans. We don't compromise on quality. No offense meant to China, but none of the things are Chinese. So it is supposed to be, they are very expensive. They are being financed by somebody. Lrbt can't finance. So we have got a list of equipments we require. We give it to whoever a donor comes to us. We share it. Whatever he wants to contribute, whichever machine, so he would finance it. And it is imported from abroad. Most of the time, for example, Graham Litton Trust in England, we send them the list, they do their fundraising, and they give us the equipment. So they provide us the equipment, they buy it, and we are giving it to them.
I understand. Since you being the doctor, could you elaborate on this thing, that why is it so that the kids have gotten eye diseases and such monumental number, such a large number, such a whopping number?
There's a food for the thought. I've been trying to analyze this thing with my background of medicine and with my age experience, and my traveling abroad everywhere. The major thing what I concluded is, or come to that when a child is in the mother's womb, lack of oxygenation affects the growth. And you can imagine, if the oxygen is less, every system of the body cannot grow as they want to. So that causes problem in the eye also.
I understand.
And the newborn are having this problem most probably because of the lack of oxygen while they were in the mother's womb. Secondly, the nourishment. Whatever the mother eats goes to the child and the development of the child. So the development defects are coming in. So they are increasing. For example, the other day, somebody was saying that in Delhi, the lifespan of people, especially the children, have decreased by 5.5 years.
My goodness.
And they were comparing it with Lahore. Lahore is my city because
And all this is because of pollution, right?
Because of the pollution. So the pollution is causing this problem. And the cities, maybe the Karachi people are lucky that they are near the sea. But the cities in the middle, they are stuck up. And the air pollution is causing a problem, number one. Then the food pollution. Food, the nourishment which the mother is getting is not enough. Thirdly, when the child is born, they need supplementary milk. They are not getting the pure thing.
Now, so in the end, I would like to just know that how competent are our doctors as far as this field is concerned?
That's a very good question, and I don't want to sound pompous, but anyway, I'm from King Edward Medical College. Most of our colleagues are abroad, and they are on very high because they are valued very nicely.
That's
and
right.
They have been educated in this country. They have been trained in this country. Aga Khan is producing so many students. They are trained here, they are educated here, and they are taken by America. So, what I understand is, I've studied in
Competence
Pakistan.
is acknowledged
Their
worldwide.
knowledge is very good. They've got a very solid knowledge. They recognize everywhere in the world. The thing is, maybe in this country they will not be acknowledged, but when you compete on the world forum, they are acknowledged.
I understand.
So, and not in a liability, but I would say that we should have gone for tourism, medical tourism.
As it is happening in India.
As it is happening in India. No offense meant to that country, but we are much better. The only problem...
In terms of competence.
Competence. In Lrbt, people have come from abroad, some donors and those people. They suggested to us that you charge us anything, we'll send you the patients. They should have a priority, they should have a room, they should come in, have the operation and go. We'll pay you additional amounts.
That's marvelous.
But Lrbt refused because then the services for the poor will be compromised.
I understand.
We do not want to do it at the cost of the poor.
You prioritize the
So
poor who
it is
can't
for
afford.
we in our hospital, in Korangi hospital especially, there is no private room, there is no private surgeon. The surgeon does not know that this is a private case and he is paying or she is not paying.
I understand. That's marvelous. That's marvelous. Anyways, thank you so much. It was really wonderful talking to you, Dr. Saab.
It was a pleasure. It was a pleasure. Thank you. Thanks a lot. Thank you. Bye.